Good evening, everyone. Thank you very much for coming. I know the weather hasn't been wonderful, so we really appreciate it. So it's an honor to welcome you to Extraordinary Journeys, Stories of Refugees Shaping Global Health. It's an event that highlights the resilience, expertise, and invaluable contributions of individuals with lived experience and forced displacement. This gathering is not just about storytelling, however. It's about recognizing the profound impact that refugees and forced displaced peoples have had in shaping global health and humanitarian efforts. So my name is Paul Spiegel. I'm a professor of practice at Johns Hopkins Bloomberg School of Public Health, and I direct the Center of Humanitarian Health there. And we're co-hosting tonight with Global Health Now, which is a daily newsletter that highlights critical and underreported health issues. At the Center, we're committed to advancing research, policy, and practice in humanitarian health. And a fundamental part of this mission is ensuring that those who have direct experience of forced displacement are not just included in discussions, but are actually leading them. Training and empowering future humanitarians with lived experience, we feel is both an ethical obligation, but also a strategic necessity. So a key initiative in supporting this is the Salama MPH Refugee Scholarship, and this is named after a dear friend of many of ours and a colleague, Dr. Peter Salama. And tonight, 4 out of the 5 speakers actually did receive this scholarship, and that enabled them to do a Master's of Public Health at Hopkins. Their journeys from displacement to leadership in global health demonstrates the transformative power of education, opportunity, and perseverance. And as a professor, there's nothing more enjoyable than teaching students and then seeing what they do afterwards. And when you hear these colleagues tonight, you'll see no longer students, colleagues, what they've become. It really makes this job worthwhile. Yet, as we celebrate these extraordinary stories, we must also confront the harsh realities faced by vulnerable populations worldwide. The abrupt and reckless dismantling of U.S. aid, undertaken without foresight or compassion, has jeopardized millions of lives by stripping vital support from those who need it most. These devastating cuts are not abstract policy shifts. They're tangible blows to essential health services, food security, and emergency response efforts in some of the most fragile and conflicted areas worldwide. At a time when global displacement is at record levels, fueled by conflict, climate change, economic instability, and rising populism, this retreat from humanitarian leadership by the U.S. government is both indefensible and catastrophic. Tonight's speakers will illuminate the challenges faced by refugees, but more importantly, they're going to highlight solutions. Their leadership and resilience remind us that refugees are not passive recipients of aid, but they're actually doctors, researchers, policymakers, and humanitarians who are actively shaping the future of global health. So I invite you tonight to listen, to reflect. If you're like me, you'll most likely cry a bit, but most importantly, to act. Investing in education, inclusion, and humanitarian assistance is not charity. It's a necessity for a healthier, more just, and more stable world. I'm really honored tonight to introduce Frances Stead Sellers, who's our host for this evening. She's an associate editor at the Washington Post, and she's led some of the most insightful coverage of health, politics, and society. Beyond journalism, she's a valued member of our center's advisory committee, many of whom are also here tonight. And we're fortunate to have her guide this important conversation. So Frances, welcome.
So thank you, Paul, and I can't tell you how cool it is to be invited to a stage by somebody who's one of your heroes. Thanks so much. And thank you to everyone who's joined us here in person and on the live stream with Global Health Now. In fact, the interest in this event has been so great, it made me wonder how many people here have been to a live storytelling event before. This is my first time moderating one. But please tell me by clapping, if you're a first timer, clap your hands. Oh, okay. We have a bunch of storytelling virgins out there, I can see. You're in for a treat tonight. And I say that even though I know that much of what you're going to hear is very hard. It's tough stuff. We'll hear about children torn from families and about the callous calculations of torture. But these are also stories of love. Love of family, love of home, love at first sight in at least one case. And our storytellers will convey their love of humanitarian work, which has given their career a purpose as they've moved on from their experiences as refugees. You know, we all have stories about how we found our way here, to the United States in some cases, to this beautiful auditorium, which is dedicated to the exploration of democratic values, and to this very special evening of refugee storytelling. So I came here first as a graduate student, married an American, and stayed. I chose to leave my family and my homeland. And despite the technology and the airlines that allow me to stay in touch, I still can't get over the fact that there's an ocean that lies between me and my family, my English family. And yet that pales in comparison with the stories of dislocation and displacement you're about to hear tonight. The issues that our 5 storytellers are going to share with us are even more resonant and urgent today. UN data suggests that more than 120 million people are displaced, forcibly displaced, and those numbers are growing. The refugee resettlement program hangs in the judicial balance, as does the future of USAID. So keep that backdrop in mind as you listen to these storytellers talk about how aid and resources help them make their way. The system works, one of them said to me just last week. Without it, I would have been dead a long time ago. These stories from Afghanistan, Myanmar, Syria, South Sudan, and Sudan speak to common human truths that really resonate with me as a journalist, combining the power of personal storytelling with absolute fidelity to the facts. Don't forget that. They're faithful to the truth of what they experienced. The stories aren't easy to experience, nor were they easy for our storytellers to tell, to repeat in endless rehearsals, and now to perform in front of an audience here. So please, let's show our support for them in a warming round of applause before we bring the first one to the stage. Thank you. Thank you. As I said, it's painful, but you really are in for a treat. And our first speaker comes to us from Kabul, where she's been a quiet and consistent advocate for women's education, bringing the benefits she received during her periods of turmoil in health and nutritional support to benefit the next generation of women and children. And a fun fact she shared with us, she doesn't like to see anything written in all caps because it's as if she's being shouted at. So please, keep your voices down, but raise your hand and welcome to the stage Hasina Alokazai. Hasina, welcome.
I was born without a country, no papers, no right. Just a name and a struggle inherited from the war. My first home was a refugee camp in Pakistan, where my parents with thousands of Afghans fled the country while the Soviet Union was invading. My parents lived there for 20 or 25 years. I was a baby growing into a small child. I didn't know what was going on there. I was young, it's kind of hazy in my mind, but I have these glimpses of memory of feeling too tired, not wanting to eat, wanting to sleep, and drinking water for several days. Later, I found out from my elder sibling that I had measles at that time. There wasn't enough accessible primary health care services, so I had to go through it. I, as a refugee girl in that camp with my family, suffered from preventable diseases, complicated with lack of clean water, sanitation, and lack of public health intervention. In 2002, when the Islamic Republic of Afghanistan established, it was deemed safe to return back to home country. So at age 4, I got to go to my country for the first time and start a new life from zero in a small rural village. We are deep rooted with patriarchal beliefs, dedicated that a girl place was in the home. But my father wasn't like them. He was ahead of his time, and he believes on equal education for men and women. And he wanted us to be educated. So he always told us, education is important for all of my daughters and my sons. I started going to school for the first time in that village with the establishment of the first girls' school. Most of my classmates thought that education was only for boys. Some dropped out, others never had the chance to start. People in that village were also affected by long war and lack of public health intervention. There was children with movement disability due to polio, or elders who had lost their hands and legs on bomb explosions. However, I remember one day at school when we were given a small pill with oral liquid. I didn't know that on that time, but that moment really shaped my future. The pill was albendazole, meant to kill parasite, and the oral liquid was vitamin A and polio vaccine. It was my first lesson in public health, a lesson that would stay with me forever. When I was 10, my father decided to move to big city for my elder sister education. If we stayed in that rural village, we wouldn't be able to pursue higher education. So with this, I got my degree in public health. However, building a career and contributing to the betterment of my country in a male-dominant environment wasn't easy. You know, working hard for 4 long years as a student to get a 4.0 GPA, but still not getting a job, it was tough. I remember I told to my dad, "Hey Dad, I'm not able to make money. I can't financially support family yet." But he supported me, and he allowed me to follow my dreams. And he told me, "Go and do what you think is best for you." To gain experience and learn skills to work independently, I worked as an unpaid intern at the Ministry of Public Health for a year. Fortunately, this led me to a paid position on that office where I focus on maternal and child nutrition. And later at UNICEF, I played a key role in implementing programs to combat malnutrition among women, children, and adolescent girls. I contributed to the team effort to include maternal nutrition at the National Nutrition Strategy and Policy for the first time, developed training package, operational guidelines, and launched the first maternal nutrition training for all nutrition workers across the country. And when the COVID-19 shut down the schools, I worked to shape the nutrition program from school to community. We not only covered schoolgirls, but out-of-school girls who were often forgotten. So life felt wonderful at that time. I had everything, I worked so hard for it. The job I wanted, the opportunity to make real difference, and more than everything, I was working for the women and children of my country who are the most vulnerable among us. But that time was so short. It was just 4 years, and everything changed. The Taliban took over. And in a matter of hours, everything we built was gone. women pushed back into shadows, banning from school, stripped of their jobs, and erased from the society. For me and my family, there wasn't any choice, just to flee. Lifting my country was not just leaving my home, it was leaving my identity, my dreams, and my purpose. When I arrived to United States, I was grateful for the safety. But soon I realized that survival in a new land comes with its own struggles. I applied for over 100 jobs in public health, but I heard nothing back. My visa status made the higher education nearly impossible. Out-of-state tuition means paying double what the resident paid. The career I built, I worked so hard for it, was stripping away. I felt invisible, and for months I felt devastated and rejected. When I was about to lose hope, I found the Peter Salama Refugee Scholarship, a scholarship designed for people like me, for those who lost everything in their life, but still dare to dream. Before applying to the scholarship, I had mixed kind of feeling. I was afraid of being rejected because the scholarship was super competitive and only one person would be awarded. Plus, I was living in Atlanta, Georgia, and the school was in Maryland. So that means leaving my family, who had always been a huge support system for me. And also living by myself, it was a scary, new experience and unfamiliar. But as always, my father supported me. He not only gave me the permission to come here by myself, but he encouraged me and he told me, go for it, you can get it. When I was accepted, I felt something I hadn't felt for a long time, possibility. As a student and now as an alum of Hopkins, it gives me identity. I'm a voice, a bridge between the world I left behind and the world I'm building. I'm learning, growing, and preparing for the day to use my knowledge to uplift others. Today marks 1,235 days since the announcement banning girls in Afghanistan from secondary education. They are prohibited from higher education, working outside of home, and raising their voice in public. What's happening right now in my country makes me feel sad and devastated. And there's nothing much I can do for it. Just to empower myself. Though the road is long and uncertain, I know every step I'm taking to empower myself and to grow make me closer to the day I can bring changes and help the women of my country.
When I hear Hasina talk, there are these words. She talks about the power of possibility and daring to dream against this extraordinarily difficult backdrop. And those are themes that I think you're going to hear throughout this evening. And it just makes my heart beat a little bit more quickly to know that there's that feeling of optimism in some sense, human resilience. And that takes me to our next speaker, who I'm very proud to introduce, who combines this visceral sense and ability to tell stories with the other very powerful tool of public health, statistics. He describes himself as a statistics nerd and told us that his favorite bedtime reading is a book called Foundations of Biostatistics. So he's also the father of 2 children. They're here, 2 girls, a proud girl dad. And he said one of his problems was he didn't know how to get them to go to sleep at night. He will share, if you'll stay for a drink afterwards and the little party we're having outside, you can share your advice to him. I think you should read the statistics book to them. So, welcome to the stage, Hussam Al-Nahas. I'm delighted to have you here.
My mom is an awesome woman. I grew up surrounded by her unconditional love in Damascus, the Syrian capital. When you ask her to describe me in one word, she would say, Kattar Ghalabe in Arabic, which in English translates into, for lack of a better word, a serial volunteer who would volunteer the entire family to do things for other. And she was right. I grew up passionate about this idea of an act that I can do that would make people's life a little bit or tiny easier. And things for her get worse as I grew up. But eventually, when I became in my middle school, I decided to be a doctor. For me, being a doctor wouldn't mean just only helping people, but helping them in their darkest times. And I worked so hard to get into medical school. And I managed to get there back in 26, aiming to unleash my commitment to help people once I graduated in 2012. My path took me through different uncertainties and brought me here to the United States back in 2019, where my passion to help patients turned into helping millions at a time. And my commitment to be a cardiac surgeon transferred into being a human rights advocate, defender, and researcher. Uncertainties kept hitting me very hard with my family. And in 2021, we were forced to apply for asylum in the United States. On April, we made that decision, and I worked for 4 months with my legal team to prepare my asylum claim. And here I am, December 1st, 2021, wearing a fancy suit, getting into the Arlington Asylum office, smiling, pretending that I'm relaxed, but barely breathing. Burdened with heavy feelings and painful memories and 1,000 pages asylum claim, I got into the office during the COVID-19 pandemic. The officer welcomed me, brought me to an office where I sat in front of a screen. He sat in a nearby office, and so we could communicate through that screen. His first open-ended question was, Hussam, tell me about yourself. I said, I'm from Syria, Damascus. I was born in 1988. And I always wanted to be a doctor. In 2006, I left my parents' house for the first time, traveling more than 300 kilometers now north the country to enroll in the medical school in Aleppo City. And I was 2 years away from graduating when the Syrian uprising started. People took to the street against the dictator, Bashar al-Assad and his regime, demanding freedom and democracy. The Syrian regime immediately started cracking down on protesters, killing people, detaining them, torturing them, depriving them of their right to access healthcare, and punishing anyone who tries to help them. They even invaded the medical school. As many, I couldn't stand on the side. As much as I tried, I wanted to graduate so I can fulfill my dream, but it just was not possible. And as crazy as it was, I decided to join a clandestine medical team called the Light of Life. That team was a group of medical students, professors from the medical school, and non-medical volunteers. Our role was to travel around demonstrations and help people who get injured by providing them with life-saving medical services and ensure their safe referral to definitive medical care. It never came to my mind how challenging, how dangerous it would be if we get caught. Until after 4 months since establishing the team, when we received a message on on social media from the team leader saying, "Be careful, 3 of the team members were detained." They were heading back from a medical mission when they were stopped by a checkpoint. The checkpoint searched their car, and they found medical equipment and realized that they were actually providing healthcare to demonstrators. 2 weeks after that, I remember waking up at 7 a.m. with my phone ringing. I picked up the phone, and my friend, who was a team member, was crying. He said, "Hussam, they burned them." I did not understand what he said until I went to the hospital. Basil Aslan, Mus'ab Barad, and Hazem Battikh were detained, tortured to death, shot in the head, and their bodies were burnt. And they were sent to the hospital with their medical IDs. It was a clear message from the government back then that this will be the fate whoever tried to help. I still remember when I got into the hospital and I saw their burned bodies and I smelled their burnt flesh. I asked myself, do I want to carry on with this? After all, and I have to be honest, I consider myself cowardly. I'm not courageous at all. But that did not matter. I just continued to work with my team to carry on their legacy. Circumstances continues to get more challenging. And what started as an injury every few days became multiple injuries every day. What started as the threat of being detained on a checkpoint became a threat of being detained anywhere. But so as our team. The team that started with 10 volunteers became a team of 20. Among those was a girl who I loved at first sight. She was the tiny, bright feeling that filled my soul, but I kept hidden. Days passed by until August 3rd, 2012. It was a Friday afternoon. After a few days spending in a hospital with my friend, we head out in a car, and we were stopped by 5 soldiers. They searched the car. They found a list of medical equipments, our medical IDs, and the tiny stain of blood on my pants. And they made the connection. They said, he is probably treating demonstrators. They immediately put the machine gun on my head and my friend's head and forced me to drive to the detention center. As soon as I got into the detention center, the officer asked us to strip naked so they can do this physical searching, and brought us down 3 floors to separate cells that were overly crowded. Days passed by, and the only thing that I was thinking about was whether I will get out alive or not, and if I will die, how bad it will be until I die. But deep inside, I was proud, knowing that if I die, I will be dying doing the thing that I always wanted to be, which is helping people. The only sound that I was hearing was the screaming of people who were suffering from torture. And the fascinating idea that I had was, if I get out of here alive, I will introduce myself to the parents of that girl and ask her out. On day 16, it was 7 a.m. on a weekend and a public holiday. A guard came to the cell, called my name and my friend's name, asking us out of the cell. He handcuffed us, blindfolded us, and took us to an office. In my head, the dominating thought was, am I going to die? I asked that stupid question to the officer and I said, can I wash my face? Because you woke me up. And he said, shut up. You will wash it when you get out. He handed me a paper with my friend, forcing us to sign a pledge to not treat anyone who is considered as the enemy of the state, who was the label they give to all the demonstrators. I signed that pledge, and to my surprise, he said, now you are free to go. I walked out of the detention center, and for the first time after 16 days, I saw the sun. And the first time I saw the sun, I made that commitment to bring justice to those who suffer from that detention center and to those who will not be able to make it out. From far away, I saw my friend. He was there to pick us up. And the first person I called was my mom. And I remember when I said, "Hi, Mom," she started crying and said, why did you do this to me? It turned out that my family paid significant amount of money to bribe corrupted officers to get me out so I don't get killed. And it turned out that my mom was brought to hospital multiple times out of distress and fear, just thinking about what I'm enduring and whether I will get out alive or not. The officer interrupted me, the asylum officer. He said, "Can you give me more details about your detention experience? I know this is not easy, but I want you to give me as much details as possible, with feelings if possible." I said, "From the first moment I get in, I realized how different we were treated. Me and my friend were the doctors. Take off your clothes, doctor." The guard asked the officer, he said, "Can I slap the doctor on the face?" And the officer said, "Of course you can, he's all yours." And I remember when he slapped me on the face for the first time, and that was the first time I get slapped on my face. A spark ignited in my ear, and I was wearing metal braces, and I felt this blood taste in my mouth. When I was brought to the cell, I had to extract the braces from my cheek one by one. Next day, my name was called, and I was brought to the office. The only questions that he was asking me: who were you treating, doctor? How did you get your supplies, doctor? Who are other team members? And I refused to answer him, pretending that I don't know anything and I'm not connected to this type of work. He got angry, he got mad, he threw me on the ground, brought a plastic pipe and started hitting me on my feet, on my legs, on my back, on my thighs, to a level where I could not feel them anymore, and to a level where I would feel pain however I move or lay down on the ground. He then brought me to a room and threatened to electrocute me. He put a probe on my shoulder and pressed a button and started cursing because the machine did not work. In detention, I cried from hunger, I cried from pain, but I also cried seeing people being tortured constantly but unable to receive any care. It was a different type of torture for me as a physician, even if I'm not personally being tortured. The officer interrupted me, the asylum officer interrupted me and said, "Who were you treating, doctor? Did you treat terrorists? Did you treat armed individuals?" And I was ready for this question. I prepared for this question, but I was shocked to the core to hear it being asked. Now, I'm defending myself as a potential terrorist sympathizer, and I'm being asked accordingly. I said, "Look, officer, I'm a physician. I'm a doctor. I don't care what is the affiliation of the people I'm treating. I'm saving lives. I don't care if they are affiliated with a regime that tortured me or with a group that is designated as a terrorist group." I reached a point where I would be in the hospital hearing an air raid, rush physically to my close friends in the hospital to be as close to them as possible, hoping that if the hospital get destroyed and collapse, I would die with them, so I don't witness them dying and leaving me. I'm a healthcare worker. I treated people, I saved their lives. I'm not a judge. The interview went on for 7 hours. I left the office at 4 p.m. destroyed. At the end of the day, the core of my values were questioned. And I was lingering on that question between me and myself. Did I make the right decisions along my whole life? Did I do anything wrong? I sunk deep into major depression, into triggered ADHD, and I felt afraid of my identity, my Syrian friends, my Syrian family, the work on Syria, and my Syrian community, and my Syrian passport, and everything related to Syria. The only thing that I was trying to push my way through was continuing the meaningful work that I was doing with Physicians for Human Rights, documenting atrocities committed in Syria and working hard to bring justice to those who were endured these atrocities. 3 years passed by, and my asylum claim continued to be lingering and extended security clearance. Until that day, December 8th, at 9 p.m., 2024, myself and the girlfriend from Syria, Yasmin, who became my wife, my daughter, who is 8 years old, Sema, who we named after her mom's fake name from Syria, and our 2 years old daughter, Selena, watching the news unfolding. Bashar al-Assad have escaped the country. His army, his security forces, and his regime collapsed. And the country is ours again. I kept looking into the screen and looking into my family again, not believing what is happening. The regime that stole my youth, that stole my future, that stole my dreams, the regime that killed many people is no longer there. And I started thinking about my friends who were not there to witness this day. My mom, who endured a lifetime pain and fear of her son, who she raised to stand up for what is right. And for the first time, I started having hope. For many years, I experienced exile. I struggled with an identity that felt both powerful but fragile. And for the first time, I felt that there is a pathway forward. But these news brought a new uncertainty for us. I remember Sema. She asked me, Dad, are we going back to Syria now that Bashar al-Assad is gone? I did not have an answer. After all, I know that my time in the US equipped me with the knowledge that I need to document the atrocities and the human rights violations and crimes that were committed in Syria. So I stood up. I whispered to myself, saying, whatever happened next, I will continue fighting, not only for Syria's future, but for the dignity and justice that everyone, every person, every physician, every child, every mother deserve. All of a sudden, hope is real again. Thank you.
Sam, you leave me breathless, and I think when I hear your story back to that sentence where you say you're really not you describe yourself as a coward, and then say you're not, you don't have the courage. And I think we need a new definition of courage, because that story certainly reflected courage to me. We're going to move on to our next storyteller, who came to us again across a harrowing trek, in her case from Myanmar through Thailand, on to Baltimore, thanks to Hopkins, and then Colorado and North Carolina. Her story is also an extraordinary journey of self-reflection and self-recognition that I think everybody here will learn from and see themselves in. A funny fact that she told us is that despite the true drama of her past, and maybe it's because of the true drama of her past, she's an enormous fan of crime podcasts. So let's welcome to the stage Nan A.A. A very warm welcome, Nan.
And we already remember the day that my siblings and I went to the school, only to meet me by the pile of ash. Our school has been burned to the ground, which was likely the result of a civil war broke out between armed groups in Myanmar. Of course, as a kid, brain, like, yay, no school mean more time to play. For a moment, I was relieved. I don't have to go to the school. I did not have to go to school, no studying. Like, we can play as much as we could. But that feeling was fleeting. Later on that night,
my mother woke me and my sibling up in a rush. She said, "Hurry up, put on your slippers. We need to leave now." Me stay half asleep. Anyway, we were following her lead. We were making through our way to the riverbank, take safety under a large tree on the riverbank. And as I sat there, I was looking up to the sky and see the flying bullet. And it was like a shooting star. Of course, I could still hear the shooting sound and bombing from the distance. It was the memory and the sight that I would never forget and stay with me since. We stayed there until dawn. In the morning, we made our way back home. We packed everything that we could, foods and some clothes, and then we began our journey to the safety. We trekked through the mountains into weeks and months to find a safety place. Eventually, my mom made such important decisions for me, and then she decided to leave me alone at a related place, in very unfamiliar place that I never been there. And she rarely visited me, and then she's already like said one word or like few words: "Stay here, go to school. You need to be alive. You need to be alive. As long as you are alive, you can do anything that you want." And then she will be gone, and she will be gone for a couple months. I will see her probably twice a year, most of the time, and I was alone there, grow up alone in a related place. And every time she showed up, I will always ask the same question: "What are my siblings? What are my fathers?" She will always give me the same answer: They were at the same place too. They were somewhere else. As long as you go to school, and then you will see them again. She will always emphasize that we'll go to the school. And with no much explanation, I started to focus on my work with the hope to reunite with my siblings. And then I finished my class, and then I would eventually fall in love with learning. And without seeing any siblings, weeks came into months, and a decade later, my mom showed us again. "Hey, pack your things, you have 1 hour left to leave." And as a kid, and we did not have a chance to question my mother much. And I packed everything and put in my bed, and hours later, me and my mom found ourselves at the back of a large truck. But we had to cover ourselves. And then I will ask my mom, "Mom, when do we have to cover ourselves?" Because we were the truck was driving through industrial road. My mom said, "We cannot be seen by them. They mean the soldier. If they saw us, they will kill us." And it was very difficult to breathe under a large blanket on the dusty road. I fought so hard to open the blanket to grasp a fresh air, but knowing that the risk was too great. We eventually made to the border, to Myanmar border, and get ourselves on the boat, cross the river, eventually get ourselves into the refugee camp. The name of the refugee is Myanmar refugee camp, who also where it's located in Thailand. And it was where I also reunited with my siblings. After so many years apart, a decade later, it was so awkwardly strange to reunite with your siblings, because we barely recognize each other. But we could still see the ribbon and some mud on our face. And there in refugee camp, I also have a chance to work as a healthcare worker to provide healthcare service to the refugee population. It was where my passions to be a nurse and also humanitarian were born. And I went back to school and then started to learning how to speak English and then grammar in the early age of your 20s. It was not easy. Eventually, I finished my GED, and even secure a full scholarship to finish my nursing degree in Thailand. After I graduated in nursing school, I continued work with organizations that provide healthcare service to the refugee population and the migrant community on Thai-Myanmar border. And I knew that I could do more. I could be useful beyond the clinic, beyond the hospital. So I countlessly searched for opportunity to do more, to educate myself more for the community. So in 2021, Hopkins gave me the opportunity to study Master in Public Health, coming to the US. That was where I started to equip myself with more skill, and then could be able to do more for my communities. After finishing my Master in Public Health, I continued work with organization in Denver, Colorado, to provide mental health care service, specifically to the refugee populations. And my work gave me opportunity to question myself regarding my mental health and well-being. And Denver, Colorado could be a very beautiful place to others, but it was a new and strange place to me. It was cold all the time. And I was alone, very lonely in a very cold place. And with my job gave me opportunity to question myself and my well-being. And I started to realize that I was struggling. I was living nightmares and guilt that I could not shake off. And I did not want to bear anymore, because those brought back my childhood memory. And with heavy heart, I picked up my phone and called my sister, who also made to the US through the resettlement program. And I called my sister, who is living in the North Carolina. I called her up. I said, "Hey sis, I could not do anymore. I was really struggling. I'm living through nightmares." And without hesitation, she said, "No worry, I got your bed. Just come back and live with me." And without any difficulties, I took a step that I much needed. And days later, I found myself moving in with my sisters, and who is now living in North Carolina. And through her companions, and not only I enjoy myself, I enjoy myself to be with my family, and also I could become a cool dad to my niece and nephews. And now I have found hopes and also healing through through our together activity, especially the artworks. My special activity with my niece and nephew was drawing, especially her drawing. She's always drawn a home with all our family members in it. Thank you.
Don't those words echo for you? I wanted to do more. I was searching for ways to help other people. I just, again, leaves me with a feeling of such admiration. Our next powerhouse performer comes to us from Sudan, and she's taught herself English and did so well that everybody there thinks she's an American. She fled her country's civil year just 2 years ago, but before doing that, she was serving as the youngest public health officer in the country, working on the country's COVID-19 response, on global health, and on advocating for health equity. She tells me she's often the smallest person in the room. I don't know if that's true. She's certainly not the quietest, and she's going to bring you a wonderful story here. So let's get loud for Asil Sali.
Well, this is happening. So, my mom is the best mom in the world. A lot of you might think it's subjective, but it is my truth, and I stand by it. She wasn't just phenomenal, or isn't just phenomenal, but she is both morally and emotionally intelligent. And she taught me that. An example, when I was 4, I am very clumsy, was very clumsy, still is. I broke a cup. My mom asked, "Was it you?" In denial, I shake my head. Of course not. And then she continues to say, I remember very clearly, don't be afraid. There is no fear between us. And as long as you say the truth, I'll never punish you. And that's how she planted in me the sense of truth and justice. Sadly, after that, my world changed. As I grew older, my mom grew weaker. She was diagnosed with a very rare genetic disease, a muscle dystrophy, that was very invasive in women. My reality changed. I started to see a lot of things clearer without her shield. We started going to more hospitals, and that was the first time I was struck by the reality of Sudan's very extremely fragile health system. At the hospital, sometimes there was no electricity. Other times, specialists weren't there. And a lot of times there was no medication. One of the things that really struck me was when she needed surgery, and we couldn't find her blood type, and we had to delay that surgery. My brother actually had to donate to give him another bag in return. And that is just the reality of Sudan, and that was before the war, and now you can imagine. But you know what? I was like, Seal, we can change this, of course. Very delusional, everyone. I was like, okay, what do I need? Education. How do I help the health system? Okay, let's go into pharmacy school. I do that. I carry my same personality, very active, bubbly, and wanting to do a lot and change. I realized that health goes beyond the walls of the hospitals. Health extends to the community and to the people. And while in school, 19-year-old, I realized people around me were bleaching their skin. And I asked myself, what's happening here? And it was more of an endemic, to be fully honest. All these ladies were trying to get lighter to meet impossible society standards, to be suited with better marriage perspective. And it might not make sense to the people in that room, but that was the reality of where I came from. And I was like, yeah, I need to change that. Of course, I took initiative, started this campaign, got a lot of students to follow me, went to random markets, talked to random ladies, and raised awareness. The thing that these women didn't know is that not only did those chemicals make them sick, but it actually was killing them. Not only did we raise awareness, though, we also gave them natural alternatives. It was very big, very influential. I was on local TV for the first time. And then I was like, whoa, this is such a good thing. I want to do this in the future. At that time, ironically, I really didn't know that was public health. I didn't know that was just communication, but I later came to know. But that's where my passion was birthed like that. But sadly, before I finished pharmacy school, my life actually biggest tragedy till this moment happened, which is I lost my dear mom. May she rest in peace, Allah yarhamah. But I didn't lose her soul, I didn't lose her guidance, and she is still my North Star. And I carry her vision and belief with me. And she had big ones. But I still wanted to make change. I still wanted to do bigger. So I joined the Federal Ministry of Health 2 weeks after I graduated at 21, where I started working on national health policies, a dream come true. Later on, the pandemic, vaccines. One day, I met a very tiny girl like me in a hallway who introduced me to global health, and I was like, whoa, what, you can do more? And yeah, that was my journey. I became an officer, international representation, representing my country's health disparities in all the global health forums and arenas, from World Health Assembly to UNAIDS, speaking about maternal death, HIV, and everything. And it went beyond, from talking about Sudan's health disparity to the continent, and later on the world, actually. I was like, whoa, this is great. But wait, I'm not making decisions. I didn't like that. I'm very assertive. So I was like, okay, I need to be on the other side. I want to be on that chair. But how do I get there? And that was when I realized I needed a very strong degree. And I started looking into schools, and I found Johns Hopkins, the #1 school in the world, in my opinion. I applied, of course, because, again, delusional. I got in. Yay. Not only that, but I had the Fulbright, which is the best scholarship, 1 out of 3 in the country. I made it, and it was my dream. But one day, that dream vanished, and real quickly, actually. April 15th, 2023, I woke up to a call, don't leave your home. The fighting has started. I later that day realized that that was war. For context, Sudan is a very friendly country. People don't fight, very peaceful, so that was really bizarre. Second day, I wake up into the sounds of missiles. Jumped out of my bed, ran out of windows, which is the only thing I knew. Stay away from the bullets. Stay away from windows, bullets will come. I move away from the windows, but the sound comes closer, and so as the reality of death. I sit on the floor that day, and I say, this is it. Ashhadu anna la ilaha illallah wa anna Muhammadan Rasulullah, the words that Muslims say when they're about to die. But then the thought that was in my head, I was like, hey mom, here I come. But I was also like, okay, I can't die away from my family, my dad, brother, and sister who are in another town. And I also, did I do it all? Did I make the change I wanted in the world? Well, that didn't happen, I'm here. But I am here because my aunt saved me. She was very distressed the day we were trying to flee, but very delusional, me again, and cautiously optimistic, told her, hey, we're gonna be fine, we won't die. Of course, no guarantees, did not know. But she looked at me and she was like, it's not death that I fear, it's other things. As she looked at me and her 10-year-old, and then, for those who didn't understand, is war-related war crimes towards a woman. But I make it safely, I make it home, I stay with my family, but it was only a month, because later on, in a span of 2 hours, my whole life changes. I get a call from my aunt who says, make a decision now, we're leaving to Egypt. And that meant going through the war zone again to try to flee and get my scholarship/visa. Come here, or leave my family. To a lot of you, it's a no-brainer. Of course, leave the war-torn country. But to me, it was my family, and they're my everything. But the words that kept replaying in my head is my mom's last words to me, which was, you need to leave, you need to make it out, because one day will come where everyone will rely on you. And I did, and I made it. And I made it to Johns Hopkins, and I actually did graduate. But through school, it was really hard for me because I pretended to be a normal student, did so well at that, but I always had this idea in the back of, what if I lose my family? Sadly, December 2023, that nightmare came to reality when the militia actually got into my hometown, and I lost communication with my family completely. But they survived. I heard so many things. I was going through finals that day. Oh, you're so strong. Oh, you're so resilient. No, that's not a choice. People like me who are refugees don't have the privilege of being weak. You have to continue. But thankfully, my family makes it. They're safe, they're in Cairo. But war goes beyond just war, safety. My dad's first words are, I'm a refugee. He lost his 60 years of life, of home, my brother, his business, and my sister, her education, which pains me the most because I am here today because of my education. And if you strip everything away from me, you will not take away my education. And that is my armor against the world, for me and for my loved ones. One thing, survivor's guilt, and it is real. Everyone that talked today suffers from it. For every one of us that survived, thousands didn't. And they continue to leave because war continues. But we talk about it, and we live with it every day, but we try. I am here today. I am very grateful, extremely happy, and lucky because of my phenomenal parents who believed in me, my dad who supported me through a patriarchal society to come to this country, my mom's belief and vision for me, which is a crazy one. She thought I could change the world. Very, very tall order for a very tiny person. But hey, I'm trying. And here I am, the daughter of Sudan, and as long as I do have breath left in my body, I will have Sudan on my tongue. Thank you.
I was just very peripherally involved in some of the conversations early in the design and building of this auditorium and the whole conversion of the museum into this building. And I can't think of a prouder moment than to hear in here those words, education is my armor, and what that means for Hopkins and also the broader notion of democratic values that are enshrined here. We've saved a spectacular storyteller for our close. He's a man who doesn't know when his birthday is, so he makes it whenever, wherever, and however. If there's a slice of cake on hand, it's his birthday cake. If there's a party, it's his party. It's his birthday party. And his story is a gift to us today. Unfortunately, he can't be with us. He's working in Juba, South Sudan, but he's joining us by Zoom. So please welcome, with a noise that could reach 6,000 miles away, Kemish Kenneth Alier. Woo!
I'll never forget the first time I tasted milk. The creaminess, the sweet smell, the smoothness. I had to have more. And I heard that school was a place where you could have more of it. You see, many years before my first taste of milk, the war in my country, Sudan, had intensified in 1989, forcing the whole village to flee for safety. The bullets were raining like never before, and everyone had to grab what they could and leave everything else behind. I'm very grateful I wasn't forgotten in the heat of the moment, where I was carried by different relatives on their back shoulders through that 5-day journey from our village to the border of Uganda. At the border, we were received by UN agencies and NGOs, given meals, and later relocated to the camp, about 400 kilometers away from the border. I was too young to remember the details of the journey from my village to the camp, but I was later told stories. I was later also told my dad, who was away in the Liberation Army before I was born, later passed. And growing up, I've always had this sadness in me as a kid of not getting to know my dad, what he was like, Would you have played with me, taught me things? Was he a sweet dad? Or was he a hard dad, difficult one who could have shouted but still love you? Would you have been proud of me? I had so many questions that never get answers to. The camp was my home for the next 20 years. It was here where I had some of my fondest childhood memories growing up. Played hide and seek around the rows and rows of tents where we lived. It was also here where I had my first taste of milk. And the promise of having more of that lured me to school. School, my first class was under a tree. We would sit on the ground, write with our fingers on the soil. Then the teachers would come and mark when we go. When it rains, there was no school. I would always get embarrassed when other kids talk about their fathers. You see, in my community, people are known by their fathers. This is the son of so-and-so, this is the daughter of so-and-so. I would avoid those interactions and keep to myself. I would spend hours and hours over the weekends in empty classrooms by myself. I became more and more introverted. You see, after some time, the camp life became very difficult. The food ration after some time was cut. So I remember times when we go days and days without eating, and we'd go to the wild, look for wild berries, look for weeds, and survive on those. Those were very difficult times. And when I was 12, I developed swelling in my face. It was so painful. I was taken to the only local dispensary in the camp. It was a long line, so we lined up, waited. And when it was finally my turn, we were told the doctor who works on this kind of problems was not around, that the doctor comes once a week from the capital city. So we were turned back. And it was so much pain without any relief. At that moment, as a kid, I thought, could I become a doctor so that I don't need to go through this pain, so that my mom doesn't need to wait in the line for this long? I didn't know how poor we were until I left the camp to go to a boarding school. When I went to school, I lined up and I wasn't putting on anything nice or nice backpack. My shirt was torn and I was carrying my books and pens in a plastic bag. I saw everyone was looking at me in a funny way. And at that moment, I felt the feeling of not belonging, that inferiority coming over me. Over my years in the school, I was called names. I was called the person who ran because of trouble in their country. It was their way of saying, you're just a refugee. I was bullied. I was bullied until I went into depression. I would avoid engaging in curricular activities, going to play games with other students. I would remain in the dormitory and not go to get food from the cafeteria for days. I went into serious depression. Academics was my only way out. I honestly had no plan B. Paid off. After a while, slowly and slowly, I started having friends whom we could discuss school assignments with. It was at that moment when I was so determined to become a doctor. On one hand, it was because of my experience in the dispensary in the camp, when I had no relief, I was in so much pain. But on the other hand, this feeling of wanting to prove myself. I was so lucky to have support and go to university to do my bachelor's in medicine. As I was finishing my medical training, Sudan split. And South Sudan became a country. And there was one thing in my mind, to go back and fulfill my childhood dream, to work as a doctor in my own country and make a little money. So in 2013, I went back to South Sudan and worked in a hospital. For once, I felt I belonged. Nobody called me names. After a few years of working and seeing the health system challenges in South Sudan, and also at the time when South Sudan descended into another internal conflict, I wanted to do more. I wanted to change the system. So I went on to work with Chipaigo and UNICEF on maternal and newborn health policies and programs. It was at that time when I met a PhD student who was doing research in South Sudan on newborn health in humanitarian settings. After a few chats and talk about Hopkins, I was intrigued. So I started doing my research about Hopkins. The more I learned about Hopkins, how great a university it is, the more I became so skeptical about myself, whether a refugee kid like me would ever walk through those doors. I wanted to do more, so I needed more. So I was so determined. Then I applied to Hopkins for MS-PH program and waited. The following year, the email came. The email was, "Thank you, we regret." As you could imagine, that whole feeling of a refugee came back, that you are not worthy. Hopkins is not for people like you. But this was high stake. This was more than milk. I wanted to do more. I had to learn more. And I sensed Hopkins was that key to unlocking the potential of doing more. So the following year, I applied again. I strengthened my personal statement, strengthened part of my application, and applied again. Then waited. What a joy it was the following year to receive the congratulatory email of admission in Johns Hopkins University. And better still, awarded the Peter Salama Scholarship. This is how a refugee kid, whose first classroom was under a tree, went on to graduate from the world-renowned university, Johns Hopkins. Better still, it was at Hopkins where I met my future wife. We first met during a humanitarian class. I was very sure she was the one. Her smile was like nothing I'd ever seen before. I remember to gain her attention, I would always remind her not to forget to sign in her class attendance. I remember one day I made a very humanitarian move. I asked her, "You're from a devolved country. I'm from a country in humanitarian crisis. How about we form Nexus, a humanitarian development nexus?" Friends, after a few years of implementation and rigorous M&E, the nexus happened. We are happily married now, living and working in South Sudan. It's my hope that one day, when we have kids of our own, I'll be there to love them as a dad and show them how to navigate the ups and downs of life and ensure that they have plenty and plenty of milk.
That was indeed more than milk. It was wonderful to have Kamesh, and he's going to be joining us. But I want to invite all our speakers back onto the stage, if I may. And Paul, too, can you come up? We have a few minutes for a Q&A. I'm going to start out because I've got so many questions I want to ask them. But we will be able to have questions from you all, too. There are microphones here and over there, so you can line up at the microphones. Kamish, I think, is joining us. He will be joining us, good. And I'm going to selfishly take the first question. So, I wanted to start by asking you, this was very difficult. These stories are difficult. They're full of love and humor, too, but we've asked you to relive very painful parts of your lives. So tell me, just very briefly, and any of you can take this, why did you say yes when we asked you to do this?
Yeah, I can start. So my presence here is not by accident. As I said, the small pill and the oral liquid shaped my future. So I want that to be continue.
Sam.
My wife asked me the same question because of how much I was struggling in the last few weeks preparing. But I think it was the commitment and the promise that I made to myself when I went out of the prison to make sure as much people as possible hear about the suffering of the Syrian people and hear about my story, which is one of hundreds of thousands of stories.
One of hundreds of thousands of stories. Kemish, welcome. I'm sorry you may have missed the question, but I asked, these were very painful stories, and why did you agree to join in and speak about this, to relive these difficult times?
Thank you. Joining from Juba, my main motivation to join really is to speak about this. There are a lot of other kids like me who, without probably that 1 cup of milk, would not be able to survive. So I think I count myself so lucky, but not many are so lucky today. So I want to raise that awareness that the kids out there who are in my shoes may just need that 1 cup of milk, which is the difference between life and death.
Thank you. Please do come up to the microphones. Anybody who has questions on your own, there are microphones over here and over there. I saw a wave over there. Is that a question or? No, sorry. So my next question for you is about family. So many of you have spoken about the importance of family. Can you tell us about also separation from family? I can see you nodding, and maybe you want to take that up as well, because your mother was such a formative part of your life, and you don't have her with you now.
If I'll talk about separation, I won't talk about my mom because her soul is around me. I'll talk about my living family who I last saw 2 years ago, and I'm unable to see them because of my status. It is very hard, but at the same time, all that I do today is for them. And I think that is what drives me and keeps me going.
Nan, as well, you talked about separation from family and then learning to get to know them again. Tell us a little bit more about what that's meant.
For the separation?
Yeah, and getting to know people again.
Well, I would say separation was not always very challenging, and especially you've been forced to separate from your siblings and also your family, and also force yourself to grow up alone. So yeah, I think being able to be in this new country also came with a new challenge, and yeah, I would say it was very interesting to learn new culture and people around here. It was totally different.
We have a question from the audience.
Hi,
Got it.
my name is David Ago. I am a PhD student at Penn Nursing. I study LGBTQ refugee and asylum seekers in the US. There is something that you said that stood out to me, and all your stories has been about hope and resilience, and hope that is built out of the work that you're doing to empower others, if I might summarize what I heard from a lot of you. But something you said stood out to me. You said, for us, resilience is not a choice. Could you elaborate on that? What does that mean?
Have been a grammatical mistake since I'm not a native speaker. What I mean is going through Hopkins, I did a lot, and I think I was just trying to hide the pain, the things that I was going through. And right now, going through life too. As I said, the life of refugees go beyond war, and what I mean is it's something that is like a stamp on you that you have to live with. Especially that now the war didn't end it. I'm not with my family. And I don't have a choice. I can't lay down and say, okay, I'm going to be depressed for 6 months. How are the people depending on me going to go around their lives? We not only carry ourselves, but carry our families and communities. So we do not have the ability to take long breaks and say, hey, I'm weak. So I just started to really hate sorry everyone, please don't say that to me, the word strong and resilient, because it's just not a choice. Yeah.
I don't know, Kamish, if you want to speak up on that one too. I want to make sure you have a chance.
No, I to be honest, being in a different country as a refugee comes with its own challenges. And I feel like what Asela said, as a refugee, you call names, but on the other hand, if you're given a chance to go to school, I went to school. Not all my siblings had the opportunity. I'm very lucky. So there's this responsibility that comes with it that many other people would depend on you. And I think as much as the terrible things happen as a refugee and all these experiences can lead to depression and PTSD, but still you have to wake up and be hopeful. You have to wake up every day and hope that tomorrow is going to be better and the next day is going to be better. And I think that what drives me every day, that something that I'm doing to change the lives of that one person the next day, that whether it is my family, whether it is the next child who needs support, like now where I'm working with a lot of displaced community, whether in the South Sudan and within the region, that my work is going to touch somebody's life on a daily basis. So I think as much as you have that stamp on your back that you're a refugee, I think every day you have to wake up and move forward.
Wake up and move forward. We've got another audience question over here.
Hi, I'm Imon Han. I'm also from Myanmar, and we, including two over there, are here to support Manang. We are also Burmese. I just have a question. You mentioned about working at the hospital in the Thailand-Myanmar border. So just wondering if you can, describe a bit about the humanitarian work you work over there.
Thank you. Because I was living in the refugee camp as a refugee. As you may know, in the refugee camp, there are also like NGOs that support healthcare and provide healthcare service to the refugee population, such as the IRC, but who is not longer now exited at the moment. And yeah, I was like, it started with, like, when I first got there, it started with the French NGOs, like it's called I cannot remember, AIDS Medical International Organization, and then because they could not, I always say more like budget wise, they could no longer provide it. So I think one organization and take over from another organization. So the latest organizations were International Refugee Committee, but with what's happening right now, I think they had to put out, and the whole, I would say, the program has been seed and stop, and then which means that there's no health care in the refugee camp for the refugee population. And then even though nothing, like including mental health, healthcare, just basic primary healthcare, not even paracetamol for headache, for example.
I have another question, and that is that I've had the enormous privilege of spending a little bit of time with you in the last day or so, not a lot, but there's clearly a bond between you. You're telling stories together, but also you've had shared experiences, and yet you come from enormously different parts of the world. Asil, you pointed out to me that you often think of Sudan as being the forgotten crisis, and Nan, you said much the same about Myanmar. But I wonder about that shared identity and what it means for you. Kamish just used the term having a label of refugee that you carry with you. Hussam, you look as if you're ready.
Yes, I can start here. I think what Kamish said really touched me, and I think one of the reasons why I'm here is actually to highlight that there's something common between all of us, which is this raising from suffering, from hardship and trying to prove that we can move forward, that we are strong enough to move forward. But maybe, Camus said a very strong line during his story, which is the mental health struggle that comes with this work and the hardship that we go through, but yet at the same time, we are unable to disclose this most of the times because we want to show that we are strong, we are resilient, we are moving forward. And I think what connected me with everyone here is this ability to show vulnerability between each other's and the weaknesses and be transparent about where we are weak and the support that we need, which I think brought different level of strength to this group and made me really feel comfortable sharing my story and talk about my struggle, despite the stigma around this issue, just to show people that it's not only a stories of heroism, it's actually stories of struggle, survivor, and just trying and pushing every day to move forward and do something meaningful for the world.
We shouldn't keep everybody from their reception outside for too long, but I want to turn to Paul just to finish, and I have two questions for you, Paul. One is about this vision you had, which, as I said, spoke so strongly to me because you're combining the power of personal narrative, you recognize that, with what public health is all about, and that's finding the evidence. What your center is all about is finding the evidence that can improve response to disasters and refugee incidents. So tell us a little bit about discovering, recognizing you had that vision, and then let us have closing remarks and tell us what you need everybody else to know.
Excuse me, thank you. Maybe two or three things. I guess the first is that the Salama Refugee Scholarship actually came about with the head of the Syrian American Medical Society, and I was in a meeting with him in Beirut, and he said, why don't you have a MPH scholarship for a refugee? And I hadn't thought of it at that time, and then I thought, okay, how can I go about doing that? So I went to meet the dean, and the dean said, yeah, no problem, we'll do that. And I thought,
it were only
so
that easy.
it wasn't. It was actually the head of SAMS who thought of the idea, and then to my surprise, yeah, there was not a problem. We've been doing it ever since. That together with, before Hopkins, I was with the UN for many years, and you don't get exposed to the same way as you do when you work with students, and particularly students from these countries. And so meeting with them and spending a lot of time with everyone here, their story, I saw, but actually you did, for the most part, all of you hide a lot of what you were going through. So I actually wasn't aware of all the trials and tribulations. It's some ideas, but not very much. And then we started to just speak, and then we decided we would have, with the first Trump administration actually, we decided that we wanted to be able to bring out some of these stories of what was happening, particularly with migration. And so we did a joint event of storytelling, which was a mixture of migrants and some colleagues, some was there. And it was just a way to be able to show, to humanize refugees and migrants, and really for people to really see who they are. I would say one of the problems with all of these events, though, is that most of you that are coming probably already have and feel for refugees and migrants. And one of the challenges is how to be able to do these sort of events and try to reach the people who wouldn't come voluntarily to these events, because sometimes I worry we're pontificating to the people that already believe and know the importance of this. And then in terms of being able to help, actually, sorry, there's one other thing I wanted to say, and that the other thing that I've learned over time is we as a group, there's a difference teaching people with lived experience and what they can do with their lives than many other, let's say, North Americans. And so one of the other goals that I'm hoping to do with them, but with others, is to try to see how we can teach humanitarian health and the skills of humanitarian health in low and middle income countries. And it's been challenging because of sustainability issues and others, but that's certainly one way that people can help in terms of, it's wonderful to be able to work and teach people like you, but how many people like you never actually get here, and it's the majority, large majority. So that's one of our goals, is to try to be able to do that. So to end, I would say two things is, one, how can we meet, or how can we bring these stories to people that really need to hear them, and not the people necessarily in this room, of whom I'm grateful that you've come. And then how can we work, and now with the technology, I mean, Kemish, thank you very much. It's probably like 2 a.m. where you are. But we can do so much more, I think, in Hopkins and all these other universities, to be able to bring what we're teaching to people who can't get visas and just can't come to this country.
Great words to finish on. I'd like to bring everybody up for our last, we don't have a curtain, but we're going to make it a curtain call and really thank them. So, starting on the screen, Kemish, thank you so much for joining us today.
Thank you so much.
And then everybody else, Hasina Al-Okazai, Hussam Al-Nahas, Asil Salah, Nan AA, Paul Spiegel, you don't get left behind there. Up you go. We can stand behind you.